the marathon that COVID-19 is becoming. And so that's where we are currently in this transition phase and transiting the level of support we're able to give.
Well, Dr. Ehekwazu, thank you very much. You were among the WHO delegation that went to China earlier in the year, and I recall that upon your return, we had you, of course, via Skype on Good Morning Nigeria, and it's nearly 5 months now that we had index case, and you've been, of course, battling with this along with members of the Presidential Task Force and cooperative subnational entities. What has surprised you the most about either the spread or the fatalities of COVID-19, and what has also pleased you the most in terms of response?
So thank you very much. Yes, I very much remember that program and how we were trying to look into the future. Who would have thought that we're where we are today? Reflecting on that trip, which I've done a lot, is, when I was in China with this team, something that struck me and that worried me about our country was the level of compliance I saw among people in China. I was in China with the team for, I think it was 10 days, and throughout that 10 days, I honestly did not see a single person not wearing a mask. I didn't see anybody, whether it's on the streets, in the hotel, from a distance, everybody was wearing a mask. So there was a level of compliance that was achievable in China that I worried that if we had this here, we would not be able to achieve. And that has proven right, because it's just so difficult to get ourselves to understand the risk of a small virus that nobody can see and how dangerous it is. But I think over the last few weeks, we are slowly making progress. I hope that we don't need to see the level that we have seen in other countries for us to realize that this is indeed a very serious outbreak and we need to respond as a population. The second part is also something I saw, is the level of dedication and diligence that healthcare workers need to have in order to manage these cases. And I worried that our response architecture, both on the public health side and on the clinical care side, was not prepared for a big outbreak. Luckily, we've had a lot of cases, but we've not really had the scale that we feared would happen. My point here is that we still have an opportunity, because we are not out of the woods. Every healthcare system should not only be able to provide for what its patients need now, but also what we will need if there was a big outbreak like this. So we have been ourselves from the federal government side trying to invest, but also supporting and asking every state to invest in intensive care capacity. It's not just about beds. We need to employ and train anesthetists and intensive care nurses, because really, people talk about ventilators as if a ventilator itself is going to save anyone. It's really the ability to use these oxygen concentrators, these ventilators, that are really going to save the critical people. And thirdly, it's, when we were talking previously on your show many times on why we all need to take health security seriously as a country, people thought it was a hypothetical situation and this will never happen. And the states that really did a lot are states like Ebonyi, who's on your program, because they have had exposure to a lot of outbreaks in the past. So the state government itself had invested a lot in preparing, both in terms of its lab, its virology center, for the event that an outbreak like this happens. And that's really what we're encouraging every state in Nigeria to do. We are there to support, and we will continue. Our mandate is to support every state, but we really need every state on its own to, as the same way you think about roads, flyovers, schools, is the same way you have to think about health security, because if you don't, it's at some point going to grind the economy of your state to a halt. And you would have wished you made this investment many years ago. But the best time, I will end on this, Kingsley, the best time to plant a tree was 50 years ago or 100 years ago. The next best time is today. So we must start investing in our health security. We are doing that at the federal level. The Nigerian Center for Disease Control is getting a lot of support in order so that we support the states. But really, every state in Nigeria has to take its destiny in its own hands, as well as every citizen of Nigeria has to contribute to the response by doing what you or he or she needs to do in order to prevent transmission across the country.
All right, Dr. Chikwe, thank you very much indeed for that opening remarks. As a matter of fact, Kingsley has touched most aspects of this conversation with respect to collaboration with the states and what the states ought to have done before now and what is supposed to be done now, right? So let's remain. Let's go to Dr. Daniel Umezurike, the Health Commissioner from Ebonyi State. He's in Enugu. Let's get to you. Dr. Ihekweazu mentioned clearly that Ebonyi actually rose to the occasion at the beginning and ensured that provisions were made in case of any outbreak in Ebonyi State. Ebonyi State also has been witnessing outbreaks in the past, so it is not new to that state. Hence, you made elaborate efforts initially to see how COVID-19 can be contained. Now, let us know what is currently existing in the state. We know Ebonyi status has risen, for some days now, and that you have recorded many more COVID-19 patients, even more than other parts of the eastern Nigeria. Now, let us know what is happening with respect to the provisions you have made, the infrastructure, the facilities, treatment, and what have you. Just bring us up to speed with what's happening in Ebonyi State with respect to COVID-19.
Good morning, Nigerians. My name is Dr. Umezurike Daniel, the Honorable Commissioner for Health, Ebonyi State. And my opening statement is to say that mankind is at war with this strange disease, COVID-19. And we are fighting an unknown enemy. And with respect to Ebonyi State, the situation report as of today is that we have recorded 646 confirmed cases. We also have managed successfully 532 cases managed and discharged. And we have 106 active cases still on our treatment, either in the isolation centers or in the home isolation. And unfortunately, we have lost 8 cases. And I want to say and put the records straight that this strange disease has 3 peculiar characteristics that has made it very difficult for mankind. One is that it spreads very fast. 2 is that it's one of the few diseases that can be transmitted at incubation periods and also asymptomatic carriers. And 3 is that it's one of the few diseases also that can reinfect somebody after being exposed to it and suffering it. So these are the things that has made COVID very outstanding, very dangerous. And all has to put our hands on deck to ensure that we overcome this pandemic. With respect to Ebonyi State, I will say that our response has been in 3 phases, and the 4th phase will come post-COVID, because behind every tunnel, there must be light. We are hopeful that one day the solution will come to COVID. But for now, the 3 phases has been when the cases were recorded in China, Wuhan city in Hubei province of China, on 31st December 2019. And when it was devastating the places that it has spread to, proactive, hard-working, wonder-working governor, His Excellency Chief Engineer David Umahi, we were chatting one day, he said, this disease is going to be a problem to the whole world. because he's a man that functions as if he sees tomorrow. So, well, we took it seriously, and by 30th January 2020, the WHO declared this disease a disease of public health importance of international concern. And on 11th March, it was declared pandemic. So the thing continued to spread. So within that period, Nigeria has not recorded any case, but we have started doing something. We have put in place a lot of measures to ensure that we don't even have any case. And peradventure we have any case, that we are on top of our game. So he has already put in place a lot of measures in risk communication. We emphasized it so much. We did a public awareness campaign and sensitization in all the nooks and crannies of Ebonyi State. And we started putting infrastructures in place. He started constructing, the isolation centers, both the one in the Unity Square, that is a 50-bed capacity isolation center, the holding center in Feta 2, that is a 50-bed capacity holding center, where somebody suspected can be kept and tested. And if you test positive, you'll be moved to another facility. We also started working on Elunwovu General Hospital, which is in the suburbs of Abakaliki, our state capital, to be upgraded to a COVID compliance center as an isolation center, which is a 150-bed capacity facility. And also the completion of an ultra-modern virology center complex, which is a 300-bed capacity facility in Feta 2. So, and all these facilities were equipped with all the medical equipments and hospital equipment that can help to manage COVID, including ventilators, dialysis machines, oxygen cylinders, oxygen regulators, oxygen concentrators, and everything, monitors that you can think of to ensure that these facilities can take care of COVID-based patients. Then the second era is when Nigeria recorded the case. We have to change our strategy, because this is a disease that is just like the general population, that no cap fits all. So there's no system, there's no strategy, there's no approach that can adequately take care of COVID. You have to review your approach, you have to review your strategies often and on. So when Nigeria recorded the case, we started emphasizing border checks and house-to-house surveillance. And what we do? What we do is that at the borders, we identified 50 entry points into Ebonyi State, 9 major borders, and 41 minor entry points. And we mounted security checks and medical surveillance in those places. And every person of interest, passengers of interest, entering into Ebonyi State, they are intercepted and moved to quarantine centers. And what we do, we monitor them for 14 days. We test them at the onset, and after 14 days, we also test them again. But at the time, WHO and NCDC reviewed the guideline and said, even after that 14th day, you may not test again if the person does not have any symptom. So we were doing that. And initially, we were using our township stadium, the Pangino Oruta International Township Stadium. At a point, the facility was overstretched. And His Excellency, our dear Governor, Chief Engineer David Umahi, in his wisdom, decentralized this quarantine center to 39 quarantine centers, of 3 in each local government areas. And we're using 3 development centers in this regard. So we were doing that. Also at the time, because of the pressure, we also started recording community transmission. So we also have to review our system, we have to review our approach, we have to review our strategy. And we now said what the best now is targeted active case search. And what we are doing now is to go house to house, detect people that are sick, and test them. The people that are not sick, we also educate them.
Dr. Mezurike, thank you very much there for your opening salvo. We'll return to you in the course of the conversation. Let's now come to our Abuja studios where we have Dr. Saka Audu, Commissioner for Health in Kogi State, as well as Dr. Mohammed Balogun, who was earlier introduced, is a resident advisor of Nigerian Field Epidemiology. Let's begin first here in the studios with Dr. Saka Audu, Honorable Commissioner for Health in Kogi. Doctor, for a long time, Kogi was not just a state of interest, but also a state of curiosity with regard to COVID-19. We had all kinds of stories. At some point, we were told that Kogi had developed an app and that Kogi didn't require NCDC. When NCDC officials came, there was an attempt to forcefully quarantine them. They had to return to base. Some persons have died, and even without an autopsy being performed, they were told that those persons died of natural causes. What is the reality now in Kogi?
Thank you very much. I want to start by correcting the impression that Kogi State declined the involvement of NCDC team. Indeed, we are a state that occupies a very vantage position on the map of the Federal Republic of Nigeria. Kogi State is a central passage for all commuters from the 6 geopolitical zones in Nigeria. By virtue of that, we have had our own fair share of disease outbreaks in the past. Even this year, we have had up to 31 cases of Lassa fever. We have had yellow fever in 2017 in Okoleke axis, a disease that was initially captured as an unknown disease. And when we went there, we investigated with our health development partners. We discovered it was yellow fever, and the speed with which we resolved and controlled the epidemic at that time was considered a 21st century approach. So we are a state that has rich history in management of infectious diseases. Before February 27, when Nigeria recorded the first case, we capitalized on the existing Lassa fever structure, and we commenced sensitization then, when other states were still boasting and thinking the disease will not enter Nigeria. So our approach has been that of an indigenous approach that take into consideration the peculiarity of our location, the peculiarity of our people, the peculiarity of our resources, and the peculiarity of our economy. We did not follow the mass, the situation in Nigeria where people were actually importing foreign strategies that were developed for first world countries that could not be implemented in Nigeria. You could all see it. We're dependent on our own protocol. We look at the situation, we design protocol, state-independent guidelines and protocol that was tailored to reflect the peculiarity of our region, of our people, as I've said earlier. So that has helped us significantly. I will come back to issue about NCDC. When we received a letter from the Federal Ministry of Health that a team will be visiting, the letter was directed to His Excellency, the Governor of the state. In his own usual gesture, in his wisdom, he decided to receive the team himself, receiving civil servants. He came down to receive the team. That is how humble His Excellency Governor Yahaya Bello is. As at that time, we were 100% sure that Kogi was clean. As part of our strategies was to stop people intruding from hot zones, of which FCT was considered a hot zone then. And before the arrival of this team, NCDC did declare that they have had several of their staff infected. So His Excellency only requested that if this team could be tested, they said they were going to stay for 2 weeks in Kogi, and they are going to be moving from one local government to the other. So they were requested to at least test themselves or bring evidences that they are clean, or to be subjected to 14 days self-isolation.
Dr. Saka,
but they declined all this. No, I'm just going to the
I understand.
To the genesis of
I would like to pause you here, okay. Presently, because I'm happy you have cleared the air, on the issue of the way the government had to deal with the NCDC staff that was sent to the state, which of course every Nigerian condemned, because these are highly placed professionals, and that the state asking them to come and they get quarantined or get tested before they carry out their legitimate functions, is unbecoming. That has been established, and I'm happy you have said it here. But the good thing is that Kogi has finally accepted that there is COVID-19 and it does exist in the state, so that we can be realistic about what is happening on ground. That's the more important. We're going to come back to you, much later.
I really don't know where you got that information.
Well, because it played out.
Here.
It played out, and you have also spoken, even from Kogi State, before now, on different platforms. We saw you on TV elsewhere when you were talking about this NCDC issue and what have you, and how free Kogi is of coronavirus, even when deaths have been recorded. So let's pause it here, because you have opportunity of speaking again, right? Let's bring in our friend here, Dr. Mohammed Saka Balogu. Balogu, look, you've listened to all our guests, yes. Apart from you, so you must have gathered one or two important items to talk about.
Sure.
But then, having asked you to do that, then I also request that you talk from epidemiology, background with respect to the biological behavior of this virus. Now we are hearing that it is airborne. And if it's airborne, of course, you know how dangerous that is. So just talk on issues already raised by three of our discussants before we now get into the epidemiology aspect of it.
Yes, so I'd like to re-emphasize what my colleague and friend Dr. Chikwe said about the nature of the outbreak, that it's not something that is going to end next week. We should be prepared for a marathon. It's not a 100-meter dash. It's not a short walk, it's a hike. So we should be prepared for that. So because of that, we can't afford to have what I call pandemic fatigue. We can't see the finish line yet. So we can't afford to have the fatigue, because I can sense that a lot of people are not adhering to those measures that will help us to stop, the transmission of COVID-19 in Nigeria. We can't afford to have that at this stage. We need to adhere to all those things. Social distancing, hand washing. Otherwise, we can't get out of the situation. It's not going to happen very soon. It's going to be here for a very long time if we fail to do the things that will break the chain of transmission. So we have to do a lot more work in terms of, raising the awareness of our people, making them appreciate the risk involved. I've told a lot of people that the COVID-19 pandemic is not just a public health emergency. It's also an economic crisis. If you don't deal with it, the economy will be crippled, it can't move. So the earlier we get it out of the way and reboot our economy, the better. And the only way to do that is to adhere to these things. And of course, NCDC, the PTF, and the partners supporting government are trying their best to put in place the things that will help in terms of ramping up the testing capacity, conducting contact tracing, expanding our capacity for isolation and treatment in the hospitals, at home, in the community, and the rest of that. But as individuals, we have a great role to play. Nigeria is not like China, where adherence to a large extent can be coerced. Nigeria is a democracy, so we really have to appeal to our people, make them appreciate the risk so that they can, adhere. That's one thing. The other bit is he said something about preparedness. One of the things that determine the success of a response to an outbreak is preparedness. You need to have put a lot of things in place. It's a lesson we keep learning over and over again. What I hope this time around, we'll be able to build that lesson into strengthening the system and preparing for future outbreaks. During Ebola, one major lesson we learned was the state of surveillance and healthcare in West Africa. It was a very fragile system that collapsed within just a few weeks of the outbreak. The lesson that was learned is that we have to invest in building the capacity of our people to detect and respond to outbreaks, but also strengthening the system as a whole so that we can better deal with situations like this. So that part is also very important. So as we are responding to this outbreak, those lessons we should start building them into what we are doing. So it's like you're traveling, you are building a boat as you are sailing in it. So we have to make sure those things are there. Otherwise, the outbreak will be over. That sense of urgency is gone, and we'll go back to square one, waiting for the next outbreak to come. And nobody knows how it's going to be. Nobody expected that this outbreak would be like this. So nobody knows how the next one is going to be. It might turn out to be worse than this. And all those things that lead to the emergence of these new viruses are there. We're still doing them. We are destroying the forests. We are intruding into the ecosystem of animals. We're increasing the interface between humans and animals that leads to this interspecies jump. This virus came from animals, like Ebola came from animals, like HIV came from animals. The vast majority of the new diseases that we're having are coming from animals. So most of these things that have led to the emergence of new strains are still there. So we have to pay a lot of attention to those things and be prepared for a future outbreak.
Okay, Dr. Balogun, thank you very much. I'm tempted to return to Dr. Saka Audu. You were, while explaining, you talked about the peculiarities of Kogi State and the peculiarities of the environment, the culture, and therefore the peculiar response that the state had as against what you refer to imported first world models that didn't quite work. Could you let us into these peculiarities?
Thank you very much. If you look at Kogi State has about 4.6 million people. 70 to 80% of our populace are informal workers. Only about 20% are salary earners from local governments, federal government, and the state governments. So if you decide to lock the state, to impose lockdown, total lockdown, the hardship will be considerable. We did it. We were forced to, among the first states to impose certain restrictions, and certainly were the first states to relax those restrictions, having confirmed that it was not going to be sustainable. So if you lock down a particular state like Kogi, the people, as I've said earlier, are informal workers. People like me and other government workers will rightfully expect their salary to be running. But these people, who pays them? In countries like Germany and other European countries, even China, foodstuff, certain palliative were delivered at the doorstep of the people. But in our own locality, it is tough. We don't even have the data about our people. So it became very difficult to adopt such strategies. So that is why I said, in a situation like this, we'll look at ourselves and be realistic about the existence of the disease and develop strategies that work in our own environment. We also noticed that it will be difficult for us to reach out to other people, to every household, every family. A situation that led us to acquire toll-free lines for our people to call us, and we're the first states in Nigeria to develop the self-assessment app that you mentioned earlier. I am happy now that even Federal Ministry of Health, the NCDC, and a few more states have adopted the same strategy after initial criticism. So Kogi State has actually...
Which strategy now? Self-testing?
Self-assessment. If you go through the app, you'll be asked a series of questions of which you provide the answer. So that from our own end, we can know your situation and pick you up for assessments. So it's very practical, and we capitalize on the fact that a considerable percentage of our people have access to internet, and it worked. We receive assessment from hundreds of thousands of Nigerians, not only Eco guys, but we responded to all of them, despite the fact that some are not our citizens. So we went ahead. What we are doing currently was to move away from the fact that all health institutions could attend to COVID-19 cases. We established Conference Center for Infectious Diseases. So ab initio, with symptoms like cough, fever, and other associated symptoms of COVID-19, you could approach the center. You could also call our helplines for you to be picked up with ambulance services and be conveyed to that center so that other hospitals could be freed to attend to those with common ailments. Okay. We also cooperated with the relevant agencies like NCDC and CDC America, and we established a molecular reference lab, okay, which is currently working. But what we do not understand is the refusal of those who are charged with the responsibility to control this disease to accept data from Kogi State. It's quite disturbing.
Okay. It's disturbing.
I also mentioned to you that we have been assigned to have recorded 5 patients. Okay. I would like to give you history about those 5 patients in 1 minute. Okay. For example, you all knew what transpired when the first 2 cases were declared. I don't need to go over it. The 3rd patient, a woman who had nephrectomy, being evaluated with another renal symptoms. And the patient was sent from FMC Lokoja to a hospital in Abuja for MRI. And the patient was diagnosed to have COVID-19. I'm not saying this is not possible. But what really baffled me was the fact that the woman's son requested that 2 samples be taken and cooperated with the laboratory scientists that took the sample. 2 samples were actually taken. One was labeled in accordance with the patient's data, and the other one as if a patient was coming from another state. It will interest you to know that the woman from Kogi State tested positive, while the other one was negative.
But the same test
from the same woman. Then the 4th and 5th patient, for weeks now, I have personally made calls to directors in Gadwa Laboratory, one of the NCDC controlled laboratory. They have refused to give us, other than names of those patients, the identity of these patients.
All right.
On condition that the patients declined.
Wait, because before we go on break, I would like to bring in Dr. Chikwe Ihekwazu, because you have raised a lot of issues against NCDC with the background of what happened in Kogi State. You making Nigerians to believe that there was false information with respect to tests carried out by NCDC with respect to the lady you talked about and other patients some of whom have also died. All right, so Dr. Ihekwazu, please, this is not necessarily a matter of controversy, but it's a matter of clarity. Let us clear the air on these issues, because what happened in Kogi some weeks ago actually brought in unnecessary controversy with respect to COVID-19 and how your agency has been operating within this period. So let us know really what the picture was in Kogi, and let's get out of it once and for all. And before you leave, after answering that question, I'd like you also to look at your own personal view of what has transpired in different states. How would you score the states in terms of performance, in terms of adherence to protocol, in terms of facility, and what have you?
So thank you very much. I think now is not the time to go into the history of what has gone on in Kogi over the past few months. When we're done with the outbreak, we can go back and review and let history and Nigerians judge how we have led this response. Right now, like my brother, the Honorable Commissioner, has said, who I have worked with very closely for many years. We have 5 million citizens, Nigerian citizens, in Kogi State who need access to care and treatment. And I would like to focus our efforts on doing that. We have 36 plus 1 states in Nigeria. By far, almost all the states are seeking our support, and we have been providing that support in extremely diligent ways. To say that there's something peculiar in Kogi that is different from every other state in Nigeria and every other in the world, because this is not a Nigerian outbreak, this is a global pandemic. The test that we're doing in Nigeria and in every other state in Nigeria, it's the same test done in Brazil, in India, in the US, in the UK, in South Africa, in Ghana. It's exactly the same test. The challenge, the response that we are providing is not a first world response. Nigerian citizens are as susceptible and have the same right to protection as every other citizen in every other country in the world. There's nothing peculiar, my brother, about Kogi. Kogi is like every state. There's nothing peculiar about Nigerians living in Kogi. They're like every other citizen in Nigeria, and they deserve the best care. And our responsibility, mine and yours, as healthcare leaders, is to make sure that we deliver this. The mandate of NCDC, like I've always said, is to support the states in their delivery of this leadership. And whenever Kogi is ready to accept that support, we will carry out that mandate that we have sworn to carry out. So we remain able to support the government of Kogi State in protecting the health of their citizens. That is the reason of the existence of NCDC. It brings no benefit for us that we've not been able to do this optimally, but we are confident that we can still turn the tide. Like I said in the beginning, this is not a marathon. We can't wish this virus away. It is here with us. Whether we accept it today or accept it tomorrow or next week, it doesn't change the fact that we have community transmission going on in Nigeria now that is very difficult to stop with the conventional tools that we have. So I continue to appeal to the Honorable Commissioner to work together with us. Let's leave the political leadership to do what they do. Their role is to lead us. Let us, those given the mandate to lead the health sector, do what we need to do, and we can quickly turn the tide on the state of the outbreak in Nigeria. Testing, like I said, is not the response. It's the eye into the outbreak. If we don't test, we are not able to understand the size and spread, the trends over time, the distribution in local government. There's no way we can understand the outbreak. You know, there was a time on this program, everyone was criticizing Kano for their response. And, you know, we sent the biggest team we've ever sent to any state in Kano. Kano state government invested millions of naira. They rose to the challenge. Today, Kano is testing more than any state in Nigeria. They're not finding as many cases anymore. We're confident of their response. And together, you know, the confidence in the Kano response, if you think about how we were talking about Kano a month ago to how we are talking about Kano today, it's incredible. It shows that we can turn this around in certain states. We can turn this around if we work together across federal and state, across partners, across whatever lines we use to distinguish ourselves. And that is really what I keep offering every state in Nigeria, to work together to protect the health of all Nigerian citizens, irrespective of the state they live in.
All right, Dr. Ihekweazu, thank you very much there for your response. Gentlemen, we're going to have to take a short break. When we return from the break, we continue with the conversation.
As a strong immune system increases the chances of victims surviving COVID-19, a corruption-free society creates opportunities for citizens to thrive and prosper. Build your immunity. Stop Corruption now. Report all acts of corruption to ICPC on this toll-free number 0800 22 55 4272. This message is brought to you by ICPC and NTA.
She cried. She cried in anguish and in pain. She bears the scourge of her grief. She toils in vain for justice and succumbs to silence. He gloats over his malady. Like a beast, he pounces with no remorse. Her cry meant nothing. Her pain feeds her shame. Like an orphan, she is left to grieve in solitude. But no more will she cry in vain. Her adversaries will henceforth bear the brunt of their bestiality. Rape is evil. Rape is a plague, a pandemic of monumental consequences. We must unite and kick it out of our society.
Connect with NTA and stand against rape and rapists. This message is brought to you by the Nigerian Television Authority, NTA.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
All right, welcome back, and it's still Good Morning Nigeria live on the network service of the Nigerian Television Authority. I just would like to come back again to our Abuja studios, this time Dr. Mohammed Balogun. Dr. Mohammed Balogun, well, Dr. Ihekweazu has already spoken briefly about Kano, because Kano was a state of interest for us on Good Morning Nigeria. We had a number of dignitaries from Kano, including the Emir of Kano, that's the Sarki Kano, the Deputy Governor, prominent officials, Professor Nasidi, and quite a number of other persons. So what has happened in Kano that the numbers that seem to be climbing at some point suddenly would appear to have fallen? That's one. Then from an epidemiological point of view, virtually the Nigerian economy has reopened. One of the fastest means of community transmission that was always feared, air travel. The protocols that we established are already being breached. We saw what happened in Kano. A big man said, you cannot decontaminate my luggage because I'm a VIP, as if VIPs don't carry the virus or they don't suffer from the virus. Do we face a much graver risk now with the reopening of the economy and the challenge of having to, resuscitate livelihoods?
Yes, so thank you for those questions. To address the first question, I think the index case from Kano was not the first case in the outbreak in Kano. The outbreak had been going on for a long time before the index case, meaning the person that was detected, tested in the lab and confirmed. So, and the kind of people that were dying in Kano around that time actually fit almost 100% the demographics of the kind of people that have a bad outcome with COVID. So those elderly people that were dying in Kano most likely were dying of COVID. So Kano had progressed, it had advanced in its outbreak before we even knew what was happening. So it's possible that the outbreak is on its way out in Kano. It went, it ravaged uncontrolled for a long time, and it's on its way out because people are actually collecting. I myself, for a long time, we've been discussing this and what exactly is happening in Kano. They are testing, they are not finding the cases. They're actually testing, they're collecting samples. Within a few days, they collect thousands of samples, and they're being tested, and you have a low positivity rate. And that's where everybody is hoping to get to at the end of the day. where you test a lot, but you find a few cases, meaning you are getting over the outbreak. So the data, if we are looking at our data, if we allow our data to guide us, to tell us what is happening in Kano, it seems the outbreak in Kano is on its way down. That is what the data is telling us.
That's interesting.
I think that's a very interesting development.
Positive development.
And other states should emulate this because, as you rightly pointed out, Kingsley, when we had a deputy governor, there was no index case in Kano. You know, and we were suggesting to him that Kano is a very big state. It has a highly populated.
Yes.
Right. And that he was giving us assurances that, look, that nothing is going to happen because, of course, he's certainly sure at that time, you know, that there was not going to be COVID-19 as we are speculating. But a week after that, of course, you know what happened there. The boom all over the place.
Second question.
Yes.
That's on reopening of the economy and the risks that we face.
So it's not rocket science. If you lower your guards, you don't obey the measures, you don't do social distancing, it's going to get worse. There is nothing that is going to happen beyond that. It's going to get worse. It happened all over the world. In many countries, in North America and Europe, where they opened up, they had to quickly close back because of the surge in cases. So we should expect to see an upsurge of cases in Nigeria because we have opened up, except if we apply those rules, social distancing, hand washing, using face masks, and all the rest of the things that we need to do, even with, you know, these kind of the increased movement of people around the country and the rest of that. So we have to find a way to mitigate. So we are beyond the point of containment. What we are trying to do now is to mitigate, lower the impacts of the outbreak and slow it down as much as possible, so that the healthcare system doesn't get overwhelmed with a high number of people that need attention at the same time.
But what's on ground now presently is the fact that people are not adhering to the protocol. It's as simple as that.
Yes, so that's what we need to do. We need to do a lot of work on risk communication. People need to better appreciate the risk involved. And now that we have a mounting body of evidence telling us that this virus is actually, you know, airborne to an extent, then we have even a greater reason to adhere to those, you know, measures, especially face mask, ventilation, social distancing, and the rest of them.
Is it not possible, Kirian, before we proceed, is it not possible that because there is also now greater information out there as to preventive measures, pharma preventive measures, that patients are saying, look, if I fortify my immune system, probably I can contain I can combat this virus if it lands. It may. You go to the pharmacy shops now, you can't find some of the commonest supplements that ordinarily you would just pick from the shelf. When I saw the price of one the other day, I won't mention the name so the Nigerians will not say I'm prescribing. 8,000 for 50 tablets, you know, another one, 12,000. I said, you are the ones that will swallow these ones, you know. Yeah. And then you have all kinds of prescriptions, expose yourself to sunlight, have some exercise. So, all those ones not happen?
So we don't recommend those things. They are not part of the recommendations that we give. We are looking at those measures, those simple things that are easy to, you know, observe. Not everybody can afford those things. They're very expensive, and there is no scientific evidence to show that they have any benefit in this situation. But we know that some people, a particular group of people, have the tendency to have a bad outcome in terms of severity of illness and also dying. So we talk about people that have comorbidities like hypertension, diabetes, chronic liver disease, chronic kidney disease, cancer, and the rest of that. So NCDC has actually come up with a guideline to protect these people that we call the vulnerable people. It's there on the website, everybody can look at it, and it's just basically to try and isolate those people that are likely to have a bad outcome. So those are the things that are targeted at specific people that can affect, you know, the outlook of the outcome at the end of the outbreak at the end of the day, because the vast majority of people are asymptomatic or they are mildly symptomatic. But those people that are likely to have a bad outcome, they are likely to die. We are trying to focus on them, make sure they get access to services in the hospital, make sure we isolate them for the rest of the people that can transmit the disease to them. That's a very important intervention that we're considering.
As a matter of fact, from your explanation, Kingsley, it does seem that we are just starting the journey, you know.
That's right. That's right. It's a marathon.
That's the truth.
Just starting the journey of this fight
against the
coronavirus, indeed.
Until at least we have a reliable vaccine.
Exactly. And well, this sort of vaccine has even been that of controversy for a long time, you know, that we may not even start discussing that now. Because one man has said in the past that it's only when we get a vaccine that this issue will be solved. And he's also talking about more viruses coming up,
yes.
because because we have corona, it does not stop other viruses
yes.
from
And I'd like to quickly make a point here. I think one of the great lessons we have learned from this outbreak is we need to build our indigenous or our local capacity to produce pharmaceuticals and biologicals.
Exactly.
We need to be able to. Do you know that we used to produce our yellow fever vaccines? In Lagos, we're producing yellow fever vaccines, rabies vaccines. The buildings are there, abandoned, nothing's happening there anymore.
Okay.
Yeah,
so we need to get that back.
That's a fine point, because
we need to get that back.
The NIPRI Director General has also been on this in terms of our medicine security.
Yes.
Now, Dr. Daniel Umezurike, let's come back to you in Enugu there, and let us know how you are ramping up the issue of testing in Ebonyi State. It's so surprising, really, that Ebonyi has to have the number of cases on record at the moment. And would like you to also let us know extra efforts being made by your government or task force on COVID-19 in Ebonyi State to see how you can curtail the spread of COVID-19 in that state.
In terms of testing, Ebonyi State has done very well, because we're the first state to be activated to confirm COVID-19. And this does not happen by accident. It didn't happen by accident. Ebonyi State has put in place a lot of measures during the era of Lassa fever in 2016, when we constructed and equipped, under His Excellency, the Executive Governor of Ebonyi State, a modern virology center with all the polymerase chain reaction machine, that is PCR machines, in place. So when the challenge of COVID came up, it was easy for our lab to be activated to confirm COVID-19, and that is what happened. So, so far we have tested over 5,000 samples, and initially we were also observing our neighboring states. And in terms of that, because this is a disease that you cannot manage blindfolded, you have to test and confirm that somebody has COVID-19 before you say that somebody has COVID-19. So that is what we are doing. And Ebonyi State has also done quite a lot in terms of providing palliative and economic stimulus. We have we manage our cases free of charge. The case management, we have a very dedicated team that manage COVID-19 free of charge in Ebonyi State. And as I was explaining before I was paused about our active case search, we want to detect all the cases, both COVID and the non-COVID, that have not presented to the hospital, and bring them to hospital and treat them. Because we discovered that when you emphasize only testing, that sometimes you emphasize more on the asymptomatic carriers that disseminate the disease. But some people are sick and they stay in their houses. So we want to bring them and treat them in the isolation centers. That is what we are doing. And before I hang on, before I pause, I want to commend the effort of my dear governor for his effort, for his wisdom, for his commitment in the fight against COVID-19, and all the stakeholders in Ebonyi State. And also to say that NCDC under Dr. Chikwe Ihekwazu has done marvelously well, because I've been in the business of this health services, and it hasn't been like that, because I know right from the time we started having Lassa fever in 2005 in Ebonyi State, we didn't have much intervention. We didn't have much support from the national until he came on board. And with that collaboration, Ebonyi State has done very well. And also the PTF, who has been there for Nigerians in this fight. So I want to say that we urge all Nigerians not to relent, because when you check the trends in other places, you see that the awareness is increasing. But it's not like that in Nigeria. When you emphasize people should wear their face masks, that is with the time they will now start saying that there's no need for the face mask. So we should emphasize all these precautionary measures and adopt them. They are very important. We should know that COVID-19 is real.
All right. Thank you very much, Dr. Daniel Umezurike, for the information you have given us with regards to coronavirus in Ebonyi State, as well as the role of His Excellency, the Executive Governor of the state. We hope he has recovered fully from the issues that he had. Thank you very much for your comments. Now, let's listen into the views of some Nigerians who've sent in their tweets in the course of this conversation. Festus Akimboyewa, the statewide data published daily by NCDC has shown a significant increase in the spread of COVID-19. States must urgently address insufficient testing and effectively close down indoor operations such as restaurants, religious centers, and entertainment venues.
Law Alpha C, most states have adopted laudable measures to frustrate community transmission, thereby flattening the curve, but the general attitude of the people is reprehensible and discouraging for them. If the virus will not go, let it remain there.
Mutana Farouk, it's high time we learned how to adapt to the situation because corona may not likely be terminated for now. It is worrisome that many people do not adhere to the precautionary measures. Attitudinal orientation should play a vital role in this respect.
Festus Akimboyewa, only few state governors are doing remarkable work to address community transmission of COVID-19 in their communities. States should pool their resources together to enable them respond effectively to the spread of the virus in our communities.
Now, Ibrahim Modu Aje says many communities have returned to the old normal. Our children that we are trying to protect by closing our schools are vulnerable with high rate of community transmission.
All right, and from Titus Monday, he says that it's so pathetic that some people are still doubting the fact that this virus truly exists and are still living lives as usual and not obeying the simple guidelines regarding this pandemic. There is little government can do when people disregard the simple rules to protect them.
Yunusa Idris, I salute the courage and resilience of Governor Rufai of Kaduna and the way he's fighting the pandemic. My advice to stakeholders is more awareness and sensitization.
And from Random Whip, unfortunately, we are not all national as the medical experts and PTF on COVID-19 would want us to, but instead we use mental shortcuts which affect how we perceive most aspects of the virus. The limits to human rationality further exacerbated under strenuous conditions such as fear.
Osman Banu Kantu, community transmission cannot be easily rid of, but rather allow the virus to die a natural death with time. This is because most state governments are concerned with revamping their economy.
Chris Simeon, travelers and people that disregard COVID-19 safety protocols are those who carry the virus and spread it around. Security operatives should be targeting this set of persons.
You have another one from Chris Simeon there, Kieran. It's very interesting. So it's almost 2 weeks now that there's no recorded case in Sokoto. This is the result of advocacy and awareness campaign. That's very good. That's very interesting. Just like we heard from Dr. Mohammed, that of Kano, which is now slowing down. Leader Solomon says participatory community engagement interventions should include accurate information. In Edo State, the massive awareness campaign is yielding good results, even though the community's transmission continues in parts of the state. The efforts of government is commendable in the rural areas. Greeting with knuckle fist is now the in thing. Kinsley. Well, Kiran, just before we go, there's a tweet here from Ibrahim Abdusalam Bello. It says, there isn't any doubt that a state like Kano is now on the relegation list of the COVID-19 league. Little or no update comes from the Center of Commerce these days. It is that either they are testing, it's no longer going on, or that everything, of course, is being taken care of. Dr. Balogun was already giving an indication of that as to how they are reading out the numbers and then seeing what's happening. There was massive injection of funds and investment in terms of also facilities. Dangote and others,
Let's get Dr. Hekwazu take this question. Dr. Hekwazu, this question is on the issue of treatment protocol. Yes, I know it may not be ethical, to disclose the treatment protocol being administered at the moment. But again, some persons who have had COVID-19 came out to say, look, that they were giving malaria drugs, and that's what they took, and they came up fine. I want you to make it clear, as to people are believing that if you have COVID and you get malaria treatment, that you're going to be okay. So how true is that? And then if it's possible for you to let us know what is on ground in terms of what you're applying to treat Nigerians, is it in uniformity, or is it a situation where each state, you're on your own, whatever you think you can do on treatment, you do?
So thank you, and it's a good place to end. I think the first thing to remember, like we've said very often, that this is a disease for which actually a vast majority of cases don't show any symptoms at all. They still are likely to transmit, especially if they're at the pre-symptomatic state. So you're asymptomatic for 2-3 days, and then you become symptomatic. And then many people stay asymptomatic, and they never have a clinical illness, so they're never ill. So many people, especially younger people, the human body on its own is able to fight off the virus without your even knowing it, and then you recover. In another big proportion of people, they have a mild illness. And when you have a mild fever and cold, flu symptoms, many people generally, unfortunately, treat for malaria without even having a confirmatory test. Then they recover from what might have been COVID-19, and then they conclude that it's that malaria treatment that led to a recovery. The fact is that they would have recovered anyway, with or without treatment, because they had a virus that led to a mild influenza-like illness. The third category, that is actually a small group of people, 5 to 15%, have a severe illness, of which a small proportion ultimately pay the ultimate price. Now, it is for these severe patients that we have the first 2 drugs that have any demonstrated impact on a better outcome. The 2 of them, one is remdesivir, an expensive a drug that was actually discovered tried for Ebola and really didn't show a lot of promise, but has now been shown to reduce the period of hospitalization for those that have COVID-19. But the most interesting impact has been from a drug that we've used for many years, actually for different other reasons, called dexamethasone. And it has been shown to have improved the clinical outcomes in people with severe disease, so people that require hospitalization and oxygen. So slowly, evidence is emerging. Remember, this virus is 6 months old, and across board, we're learning very quickly. And one thing I hope that will come out of this, just like Shakira said, Dr. Balogun said, is a renewed interest in science. This is not only in vaccine manufacturing, but from university education.
I was wondering, Dr. Yekwazu, we know that you can go on and on telling us this. I was just going to ask you, this is something that has been circulating for a long while. If you can just give us a brief answer in less than 10 seconds. And there are complaints that hotlines of the NDDC are often unattended when persons make calls. How do you respond to that? Very quickly.
That was definitely the case early in the outbreak. It's almost unheard of now. We have improved our call center so much. The challenge right now is that 30% of our calls are hoax calls. People just calling to block the line for all sorts of reasons. But our lines are...
Okay, well, thank you very much. We're out of time. Dr. Yekwazu, always a delight having you on Good Morning Nigeria, Director General, NCDC, joining us via Skype from Abuja here. Also with us on this conversation, Daniel Umezurike, doctor, that's Commissioner for Health at Ebonyi State from our Enugu Network Center. In the Abuja studios, Dr. Saka Haruna Audu, Commissioner for Health, Kogi State, and Dr. Mohammed Balogun, Resident Advisor of the Nigeria Field Epidemiology and Laboratory Training Program. Gentlemen, our pleasure having you all on Good Morning Nigeria. It's on that note we end today's edition of the program. We're back tomorrow, same time, 7 o'clock in the morning. Until then, stay safe and be well. I'm Kingsley Osadolo.
And I'm Kirin Umayo. Have a wonderful day.